If you look at the spectrum of treating hip problems, in younger people, the advent of hip arthroscopy, where we can actually put a lighted scope in the hip and do some work and repair things there, is a major advance for people that traditionally really could only be treated with anti-inflammatories and maybe some physical therapy. Basically, with a hip scope, you make some very small incisions around the hip, and then you put a lighted scope that's very small, probably smaller than the width of my pinky, and we're able to visualize things in the hip, and then through other little teeny-weeny incisions, we're able to put instruments in the hip and fix some things that are nagging problems, especially in athletic patients. I think in joint replacement, hip replacement has really advanced significantly, both in the materials that we use for hip replacement, but also in the approaches and how people recover from them. You know, traditionally when I started practice, people would come to the hospital the day before surgery, and they would be in the hospital for 3 or 4 days after surgery. As an example, I did a hip replacement yesterday, and the gentleman's going home this morning. So the speed of recovery has really improved significantly for patients, and it really allows them to return to many high-quality life activities afterwards. Some describe hip replacement as the greatest advance in surgical care in the world.